Hello, welcome to our first PowerPoint module for this course, the Social Determinants of Health. You're going to have one of these each week, and the purpose of the PowerPoint modules is really to set us up for discussion in class and also to cover some of the content and clarify what's going on in the readings for each week. So please complete the PowerPoint module by Tuesday night, and that way we will all be done with it before we meet in class. And the topic for this week is health inequity and ethics. For each PowerPoint module, you're also going to have an objectives for this week slide. And this will list the major objectives for the week. This week, our objectives are first, to introduce or review the social determinants of health perspective. I know that many of you have, probably all of you have covered this in other classes to some extent. And then the second one is to define health disparity, and in doing so, distinguish between inequality and inequity. So those are our two objectives. I also estimate the time to complete each module, and usually it's about an hour. However, if I am way off with these estimates and this takes far longer or far shorter than an hour, please let me know. You will also have a deliverables for this week slide in each of the modules. And this is a breakdown of everything or every deliverable that you have due this week. What do you need to turn in on Inquire? Every week you're going to have the reading question due Monday night. Every week you're also going to have the PowerPoint module due Tuesday night. And I also break down the different components of the PowerPoint module that you need to turn in. So for this week, you have an opening question, a content question, a video question, and a closing question, and you're going to see those interspersed throughout the module. And then finally, I list assignments. Assignments are always due on Friday, but you don't always have an assignment. Here's your opening question for this module. You're going to have one of these opening questions in most of your modules throughout the semester. So after I read the prompt, I'm going to ask you to pause the module where you are and then go to Inquire to answer this opening question. You will see a link on Inquire that's a forum post for you to post your answer. So here's the question. In Chapter 1 of Well, we learn about Sophia, a woman who was diagnosed with asthma as a child and type 2 diabetes by age 28. Identify at least 3 social or environmental factors that contributed to Sophia's poor health. And you should be able to answer this in a paragraph or a few sentences. So to start this discussion about the social determinants of health, I first want you to think about what shapes our health. And this is one of the fundamental questions in this course. As a follow-up to that, what shapes differences in health that we observe across populations? Often we think about the behaviors that we engage in as individuals, such as exercise and diet. Or we might also think about our genes. Perhaps hypertension or breast cancer runs in the family, so we assume that our health is something that is biologically determined, at least to an extent. Or maybe we think about medicines and treatments that are used to manage health conditions, such as hypertension or diabetes. And all of these things are important for health. But these contributors to health are not the focus of this course, all right? Because these are very individually focused, right? We're here to talk about the social determinants of health. Instead of focusing on the more individual level determinants of health, we're going to be focusing on the ways in which social structures and environments shape population health. And this is the social determinants of health perspective. I found a nice definition here. So according to Healthy People 2020, these determinants encompass access to social and economic opportunities, the resources and supports available in our homes, in our neighborhoods, in our communities, the quality of schooling, the safety of workplaces, the cleanliness of our water, food, and air, and beyond all of that, the nature of our social interactions and relationships. So this is really an approach that looks across social institutions, that looks across social contexts to try to understand why health inequalities emerge the way that they do in society and in our population. Also, in thinking about the social determinants of health, we're going to be considering the pathways that connect social conditions to individual health. as well as the interventions that we might consider to provide equitable access to social resources that promote good health. So in the figure here, you see a flow chart that considers connections between social determinants of health, health outcomes, and health equity. Notice that social or societal conditions such as job opportunities, exposure to discrimination, quality of housing and physical environment, that's on the left side of the figure, these can both directly and indirectly shape health. You see arrows going straight across to that health equity or health outcomes um, box on the far right, and you also see an intermediate outcome in between. So let's talk a bit about what this means, direct versus indirect. An example of a direct effect or direct connection between social conditions and health. Physical environments. So exposure to air pollution. That is going to have some direct effect on health, not necessarily through behavior because you're just simply living in an environment that has a lot of air pollution. So it's not through particular behavior that you are actually ending up with, say, poor health, poor lung function. It's simply through being in a particular environment. Now, on the other hand, we could also think about indirect effects. Perhaps proximity to green space, which is a major component of the physical environment. This is going to affect levels of physical activity. So this is our intermediate outcome, physical activity. And then this in turn is going to shape physical health outcomes. This would be an example of physical environment indirectly affecting health through physical activity. Another way of framing the social determinants of health is to distinguish between distal and proximal determinants. And this is going to be actually an important part of your course paper, being able to distinguish between these distal and proximal determinants. So first, what do we mean by proximal determinants? These are direct or almost direct causes of health or disease. Proximal determinants are typically at the individual level. For example, and this is probably the biggest example, we might consider health behaviors, such as smoking or physical inactivity, as proximal determinants. These are more directly connected to health. If you think about the figure on the previous slide, these are going to be the more intermediate outcomes. This is in the middle, right? It's something like a behavior. We might also think about genetics or physiology. These would be proximal determinants. They're very close to or within the individual. On the other hand, and this is more where the social determinants come in, we might think about the distal determinants of health. And these are indirect causes of disease that act on potentially multiple intermediary determinants. So again, those intermediate outcomes from that previous figure. Distal determinants are typically at the institutional, contextual, or environmental level. This is really our focus for the social determinants of health. We might consider economic conditions such as income, wealth, or even the labor market structure, which is at an even higher level, right? We might think about neighborhood social cohesion or exposure to discrimination. And finally, we might also consider the physical environment, so housing, exposure to pollution, access to healthy foods, access to healthcare, and so on. So distal determinants are happening at a more upstream level, right? And they have indirect effects on health by affecting proximal determinants. And we'll talk a lot more about this in our class discussion this week. Now it's time for your video question. You're often going to have videos in the PowerPoint modules to break things up and to give you another perspective or another voice besides mine. So I actually have the link to this TED Talk on Inquire, so you'll be able to find it there. And once you watch the video, I want you to answer the following video question. Explain how the parable of the three friends, and this is about 6 minutes into the talk, how does this relate to the distal and proximal determinants of health? Which of the three friends do you think best represents the way in which the US healthcare system seeks to improve the public's health? So it is a two-part question, and this is based on the video. So you can pause here, go to Inquire, watch the TED Talk, and then answer this question. So by now you should recognize that really at the center of this social determinants of health perspective is the idea that our health is shaped by our surroundings, by things like the economy, by policies, by our living and working environments, or the families that we are born into. And it's important to recognize that many of these things are completely beyond our control, and yet they shape how we live and how we interact with the world. So the question becomes, is this fair? Do some people or entire groups of people who share some kind of social characteristic, do they have the odds stacked against them in a way that they will experience poorer health and shorter lives? At the core of all of our discussions on the social determinants of health is this ethical concern, this sense of injustice. So I do want to spend some time talking about the ethical implications of the social determinants of health. And this is where we'll bring in that discussion of inequality versus inequity. This brings us to the reading that you did for this week by Carter, Pokras, and Buckett. What is a health disparity? Fundamentally, this is an ethical question. In the reading, the authors draw an important distinction between health inequality and health inequity, and this is to highlight the ethical underpinnings of health disparities. This is something that is going to underpin our discussions all semester. So disparity can mean several things. If we think about inequality or health inequality, really this just means difference. I know we use it in a lot of ways in our day-to-day language, the word inequality, but inequality means that something is unequal. There is a difference. We're not really placing an ethical or value judgment on it. We're just saying there's a difference here. So perhaps a difference across, by income, we might see a difference in cancer mortality. However, when we talk about inequity, we are adding an ethical assessment to this, and we're considering the source of that health inequality. And there are two terms that are folded within our definition and understanding of health inequity that are really important here: avoidable and unjust. So if a health outcome is avoidable and if it is unjust, then we would consider it to be a health inequity. What do we mean by avoidable? By avoidable, we mean perhaps these differences in health or disease could have been avoided through changing social structures and environments, right? So if some change was made to better the social environment, this adverse health outcome could have been avoided. The second term here is unjust. I think we all have heard unjust or injustice. Here we're saying, or we're assessing whether differences in health or disease are evenly distributed in society, or if there are differences in health that are systematically associated with certain social groups or characteristics. So do we systematically see income differences in cardiovascular disease? And those who are lower income consistently have a higher prevalence of cardiovascular disease. If so, that suggests that there's an injustice here, right? That there is something related to power or resources that systematically leaves one group with poorer health compared to another. So again, when we talk about health inequity, we are adding an ethical assessment. That's really at the core of most of our discussions of health disparities throughout the semester. We're going to do a couple of examples right now to use this language some more. All right, let's do an example and really apply that idea of health inequity. We see income differences in cancer mortality in the US. And this is actually showing us some data at the county level. So it's not perfect. We're not looking at individual level income and individual level cancer mortality, but we're looking at county level income and county level cancer mortality. And what we see here is that People who reside in poor counties are disproportionately more likely to die of cancer. And we actually see that there is some improvement across time. So we see 1970 to 1974, and we can compare that to 2012 to 2016. And we see some reduction in, say, all cancer mortality among poor counties. But we see a much greater reduction if we look at those quote unquote rich counties. So we see that there's a much steeper decline in cancer mortality. And we can also look by type of cancer and see some differences by type of cancer in just these 4 types. But the takeaway here is that there are clear income differences in cancer mortality, whereby people who live in lower income counties are more likely to die of cancer compared to people residing in high income counties. So we're going to talk about why we see this. All right, so in the previous slide, you saw that there are income differences in cancer mortality, overall cancer mortality, and several specific types of cancer. The question becomes, why do we see these income differences? How do we evaluate whether or not we have a health inequity? Well, first of all, we see this systematic difference by income. So we see something that, kind of does highlight the possibility of an injustice at play. Further than that, we can consider what kinds of distal or proximal determinants besides income could be operating here. And one key, more proximate determinant of cancer is cigarette smoking. So I do want to focus on cigarette smoking for a moment, in part to highlight the complexity of really being able to identify what's a health inequity and what's simply just somebody's individual choices affecting their health. So smoking, this is a behavior, right? We can choose to smoke or not to smoke. And we know that smoking is a leading cause of lung cancer, cardiovascular disease, other cancers in the US. So we could conclude that when a smoker develops lung cancer or cardiovascular disease or some other adverse health outcome, we're not talking about health inequity. We're talking about health inequality due to differences in personal choice. Someone chooses to smoke. And of course, personal or choice comes into this, right? People do choose to smoke, but choice is actually much more complicated than that. Choice doesn't operate in a vacuum. So when we look at who smokes cigarettes and who doesn't in the US, we see huge disparities by income. This immediately suggests that there are systematic differences in smoking and therefore lung cancer across income groups. Now the question is why? Because we see such systematic differences here, there must be structural conditions that are influencing the decision to smoke. Further, we might consider how structural conditions prevent people from quitting smoking after they have started. And there is evidence to support this. There's evidence that cigarette advertising targets working class neighborhoods and lower income neighborhoods more than white collar or higher income neighborhoods. So advertising is a huge factor. In addition, we have to consider social networks. So if you are in a work environment where you have more peers or coworkers smoking, then you're more likely to smoke as well due to that shared environment and that shared way of socializing. In addition, we could consider access to smoking cessation programs and other types of healthcare that really helps with quitting smoking. There's lower access to smoking cessation programs in lower income neighborhoods or in underfunded health centers. And then finally, we could consider the exposure to chronic stress. So chronic financial strain is a huge determinant of a whole slew of health outcomes, in part due to unhealthy coping behaviors as a result of experiencing that stress. So what I want you to take away from this is the idea that even when we're talking about health behaviors, which seem very much a personal choice, an individual decision, we need to put those into context. And when we do that, we see health inequities emerge. We see how contextual factors then shape individual behavior, which then shapes health. Here's another example of a health inequality, and I'm actually going to give this to all of you to assess whether or not what we see here is a health inequity. And this is a more current event or current topic, racial inequalities in COVID-19 mortality. And if you look at this figure here, even though it's a few weeks old, so there's more data now than there is in this figure, you see huge racial and ethnic disparities in COVID-19 mortality in the United States, especially if you look at that green line on the top. The COVID-19 mortality rate for Black Americans is significantly higher than any other racial or ethnic group. So now the question becomes why? Why do we see this disparity? And are we dealing with a health inequity here? So I'm actually going to have you answer this in the content question on the next slide. Here's your content question based on the figure in the previous slide. So after I read the question to you, which I know I don't need to do, but I'm going to read the question to you. You can pause where you are. Actually, if you want to go back to the previous slide and pause there, and then you can go to inquire to answer this content question. Is the higher COVID-19 mortality rate for Black Americans compared to other racial and ethnic groups a health inequity? I want you to incorporate the terms avoidable and unjust in your response. And then based on your knowledge of racial disparities in health, which I know that we haven't covered much of anything yet this semester, so this is going to be from other courses and from your outside knowledge. Why do you think the disparity in COVID-19 mortality exists? So pause here and answer this question on Inquire. And finally, you have your closing question here. So after I read the question, you know the drill. You pause this PowerPoint module, go to Inquire to answer the closing question. And I do ask that you come back here after because there are a couple more slides. So here's your closing question. In this PowerPoint module, we reviewed the social determinants of health perspective and the concept of health inequity. How do you think these two topics relate to one another? Right, so drawing connections between the different topics and the different terms that we've covered in this module. That concludes our PowerPoint module for the first week of our class, the Social Determinants of Health. For class this week, we are going to meet on Wednesday for the in-class group only, and then on Zoom for the Zoom folks on Friday. All right, so if you are meeting in class and you signed up to meet in class, you will be meeting on Wednesday in the classroom, Trout 306. If you signed up for Zoom, you will be meeting on Zoom on Friday. And please do come prepared to discuss the social determinants of health perspective and health inequities. I will see you in class.